In this video, we'll be discussing folate deficiency anemia by going through 5 questions. I'll read the question to you, let you think for a second, and then we'll look at the answers and talk about which one's best. If you ever were confused about why there's different terms, B-9, folate, folic acid, I was as well. Folate and folic acid is a B-9 vitamin. The word folate is because that is what is actually in the foods we eat. These are folate foods. So technically that picture there on the screen should say folate with the foods in it, not folic acid. Folic acid is the synthetic form of folate that's made in the lab and used for treatments, your IM injections and your PO. So basically we're saying the same thing every time. It's not a big deal if you use a different word, but that is why we have all 3 of those words. If you need more information on this anemia, though, you can usually find that in the vascular hematology sections of your nursing resources. This video will also include some information on the folic acid supplements, the PO, and the injection forms. So let's get started. Question number 1. A 35-year-old male patient comes to the clinic complaining of dizziness, weakness, fatigue, and upper right quadrant pain that has been worsening over the past few weeks. What is important for the nurse to ask when considering risk factors for folate deficiency anemia? Is it number 1, family history, number 2, history of vascular disease, number 3, activity level, number 4, alcohol use? And the answer here is number 4. In the question, he is complaining of symptoms of anemia, and then we also have that right upper quadrant pain, which links to liver issues. So the first risk factor I would want to be asking about is his alcohol use. And maybe I could also consider, if that answer wasn't there, does he eat enough folate in his diet, or does he have any GI issues that would stop absorption of that B9 vitamin? So the answer is number 4. In the further learning, it's a good idea to just remember your other risk factors for folate deficiency as well, which infants can have it, adolescents, and especially pregnancy, as their folate needs increase and they're just not able to supply enough through their diet. There are some medications that block absorption of folate: methotrexate, anticonvulsants, oral contraception. Hemodialysis can lower those folate levels, and also any other GI disease that would inhibit absorption of the B9 vitamins, such as Crohn's, celiac, or if they've had gastric bypass surgery and the gut is just not available to absorb that B vitamin. Question number 2. A nurse is caring for a client admitted with a diagnosis of ETOH. That is how we actually say somebody's in for alcohol abuse, and the ETOH stands for ethanol alcohol. So he's in with that and folate deficiency anemia. In caring for this patient, what should the nurse monitor for? Select all that apply. Is the answer number 1, insomnia and shakes, number 2, shortness of breath, number 3, delirium tremors, and or number 4, hypertension? And the answers here are all of the above. In the question, he had 2 issues going on, the alcohol and the folate deficiency. So we could actually monitor for both the signs and symptoms of alcohol withdrawal and anemia. So with the select all, the best method is to true false these answers. Number 1 is true, that's a sign of alcohol withdrawal. Number 2 is true, that's a sign of anemia. Number 3 is true, that could be a sign of delirium tremors, is a sign of alcohol withdrawal. And number 4, hypertension, is a sign of alcohol withdrawal as well. And if it said hypotension, you could have selected that one too, because that could be related to anemia. So blood pressure could go either way here. So the answers were all the above. And in the further learning, usually the questions with folate deficiency do link to the alcohol questions too, so make sure you always put folate deficiency with alcoholism in your mind. And so it is important when you're studying that to remind yourself of the signs and symptoms of alcohol withdrawal as well. And those are a headache, sweating, insomnia, anxiety, hand tremors, nausea, vomiting, heart palpitations, increased blood pressure or heart rate, confusion, rapid breathing. Hopefully we don't get to them experiencing visual or auditory hallucinations, and definitely not seizures, which are delirium tremors. Those can be fatal. So if you look at all the signs of withdrawal, if we kind of overall, we can see that these are hyper symptoms, and that's because they're coming off of the depressant. Substance abuse withdrawal is always opposite the effect of the substance. So if the substance was a depressant, the withdrawal is going to be a hyper state. And that's what we're looking for here. Number 3, the nurse is discussing folate deficiency anemia with another nurse. The nurse knows that. Select all that apply. Is it number 1, folate deficiency anemia is a normochromic megaloblastic, which is macrocytic anemia. Number 2, folate deficiency anemia is diagnosed by low serum folate levels, less than 2. Number 3, folate deficiency anemia can be caused by alcoholism. Number 4, folate deficiency anemia is the same as folic acid anemia or B-9 anemia. So in the thought, we just wanted to think of anything related to B-9 deficiency, anemia, risk factors, diagnosis, treatments, and they are all correct. Again, all correct. So number 1, it is a normochromic megaloblastic. If you've watched the other videos, you know by now that chromic means color, and this is seen under the microscope after getting that peripheral blood smear, and the color of the red blood cells are still red. The only ones that are not red or that pink color are iron deficiency. When that leaves the cell, that makes cells pale. So this is still normal color. And we talked, if you did the B12 video, we talked that B vitamins, for some reason, make cells big. And that's where we get the word megaloblastic, macrocytic. And the way we see that is we do the MCV lab, mean corpuscular volume lab, and that will be high, greater than 100, and basically that just means you have a big cell. And then number 2, that is how we can directly see folate levels in the bloodstream. And number 3, we know folate deficiency is linked to alcoholism. And in number 4, we know that folate can be interchangeable with the word folic acid or B9. So all the answers were correct. Number 4, a client admitted with alcohol-induced hepatitis and folate deficiency anemia is to begin folic acid supplementation. Which order would the nurse expect? Number 1, banana bag IV Q24 hours. Number 2, folic acid 10 milligrams per day, PO. Number 3, folic acid 5 milligram injections, BID. Number 4, to increase foods with folate. So the answer here is number 1. In the question, we have to realize he's pretty acute right now. He also has a hepatitis going on. His folate is deficient. So what would we expect? We would expect an order that would replace that folate pretty quickly and give him back his nutrients. And so the nurse should expect a banana bag or IM injections until the patient is stable. Then you can switch to the oral. And if you're doing oral, it's 1 milligram, not 10 like what was in the answers. As long as there's no more malabsorption going on, he can begin oral. It's too late for number 4, the foods at this point. It's too late for that. We need some interventions that would take effect more quickly. So in the answer, for further learning, the answer is number 1, and that picture is the banana bag. It's that color, and we call it banana because it's yellow. It's that color because it has all the vitamins in it. So IM, IV, or sub-Q may be necessary for malabsorption syndromes or in a situation like this. And we're going to take advantage of this slide to also just review any side effects of B9 and any nursing considerations. So B9 side effects, it could cause a bad taste in the mouth, nausea, loss of appetite, so some GI issues there, confusion, irritability, sleep pattern disturbance, even some neuropathy if it's overdosed. So it's kind of hard to do, but it can happen. And the duties with this one is really to just watch for that GI irritation. Now in this case it was IV, but with the PO, like I know I can't take my B vitamins without food. I will feel sick for the rest of the day. B vitamins can really cause some nausea. Question number 5. A client with folate deficiency anemia is choosing his dinner. Which choice is best for his anemia? Is it number 1, steak and sweet potatoes, number 2, chicken, gravy, and mashed potatoes, number 3, spinach salad with mandarin oranges, or number 4, spaghetti and meatballs? And the answer here is number 3. You should have been thinking about foods that contain folate, and that picture's a good one. And down below, here's all the foods, because you know they like to ask you about your diet. So first of all, know that the dietary allowance, so what they want you to have every day, is 400 micrograms per day. That is going to be different than the treatment for it. Remember, the treatment for it was 1 milligram PO per day. So this is just from your foods what they recommend. And the foods with high levels of folate are mainly your green leafies, like spinach, asparagus, avocado, broccoli, romaine lettuce, Brussels sprouts, any of your greens, mustard greens, cauliflower, beets, celery, carrots are in there, squash. And then we also have beans, so legumes like black-eyed peas, black beans, kidney beans, pinto beans, and then fruits like oranges, bananas, papayas, grapefruit, strawberries, raspberries. And then some of your carbs, your fortified rice, breads, and pasta, they can also put folic acid into. And beef liver and eggs. Eggs are a great source of B-9. So we have green leafies, legumes, fruits, fortified pastas, rice and breads, and then beef liver and eggs. Hope you feel like you know more or remember more about folate deficiency, anemia now. If you liked doing questions like this, we have more videos. Please subscribe to our channel. Don't forget to like this video, and you can always find us at sinestrategies.com.